Hi, today we are going to talk about an interesting topic: sexual dysfunctions, psychogenic origin. Psychogenic origin of sexual dysfunction is very common in very young people. They have lot of misconceptions, myths. It is some extent common in 40 to 50 years also. Sometimes it is common in old age also. There are some factors which is predisposing. Some factors will precipitate sexual dysfunction. Some factors will maintain the sexual dysfunction for a long period. So if we know all these things, then we can protect ourselves or we can come out of this problem. So we have to understand what are all the factors which predispose, precipitate and maintain the sexual dysfunction in young, middle and elderly people. Predisposing factors. What are all the factors predisposes? Number one, restrictive upbringing. Very much religious. They are very much restricted from childhood. This is one of the important factor for sexual dysfunction. Number two, disturbed family relationship. Disturbed family relationship is another important. Third, sexual abuse. Number fourth, poor sex education. There is no sex education at all. These things can predispose psychogenic sexual dysfunction. Number two, what are the precipitating factors? Relationship problem between the husband and wife. Random failure of sexual intercourse. Once they fail, they end up in deep trouble. Third, infidelity, sexual affairs. Fourth, partner's problem can produce. Vaginismus in female can produce erectile dysfunction in male. Erectile dysfunction in male can produce sexual dysfunction in female partners. Depression, anxiety, sometimes aging can precipitate sexual dysfunction. What are all the maintenance factors? What are all the factors which maintain the sexual dysfunction? Number one, performance anxiety. This anxious tendency can maintain the sexual dysfunction. Number two, fear of failure. Third, partner's demands. Fourth, poor communication. There won't be a good communication between the partner. Guilt feeling. Fifth reason is they feel guilt. Sixth, loss of attraction can maintain the sexual dysfunction between the couples. And again, seventh is depression. Depression can cause sexual dysfunction. It can continue. So, if we understand all these things, then we know child should not be restricted. It should be free. Religious restriction and not educating sexually adequately and sexual abuse in childhood. All these things can cause sexual dysfunction in later years. So, we have to take care of all these things for our kids. So, we can avoid all these problems in later years. Thank you.